Ntokozo, thank you. Okay, so we are still expecting at some point an announcement from NERSA about the increase in energy prices. But still, strange to tell everyone there'll be an announcement and then postpone it again. Well, the moment there's more information on that, Ntokozo will be back with you with the latest. There's a huge conference underway in Kigali at the moment about health systems on our continent. Its technical title is the Second International Conference on Public Health. One of the people speaking there is Dr. Ebere Okereke, and she is a technical advisor at the Tony Blair Institute. Dr. Okereke, good afternoon to you, and I really appreciate the time. We saw during the COVID-19 pandemic the huge problems with capacity and resources for public health systems on our continent. What lessons do you think we've learned there? Where do we need to concentrate?
Right. Thank you for having me. It's a pleasure to be here and joining you from a fantastic, very exciting and dynamic conference. So one of the lessons, or amongst the many lessons that we're learning from the COVID pandemic, is the necessity for us to put health and public health at the center of everything we do, economic growth, development, etc. Because as we saw, the pandemic, through the impact of the health, the burden of disease, actually knocked back our development indices, our economic growth slowed down, and general other health consequences also were exacerbated. So one of the key lessons that we've learned is that every government should put its health priorities at the center. And that means that we need to move away from relying on donors to be the main funders of our health infrastructure, our health programs, and start to look towards domestic financing more accurate, more consistently, and aiming towards the goals that we committed to more than 2 decades ago in the Abuja Declaration, to have at least 15% of our annual budgets committed to health programs. We happen to be in Kigali at the moment, which is one of the few African countries that's actually met that commitment. We need to move beyond that. And the other, a good thing we did learn from the pandemic was the value of having a coordinating body such as the Africa Centers for Disease Control, which was able to optimize the impact of the resources we did have, limited though they were, through the auspices of the AU, getting the heads of government to respond very quickly and consistently to the challenges of the pandemic.
One of the things that I think we've learned on our continent, and arguably in South Africa, is that if you have a weakness in public health in one country, it will affect the countries around it. So, for example, we know that Zimbabwe has a very weak public health care system. People come to South Africa for treatment. As a South African, I think we have a duty to help them, but it does affect us. During the pandemic, if you're the United States, you have Mexico on your border, you are going to see exactly the same kind of problem. Is there a lesson for everyone there?
Absolutely. The mantra that the Director General of the WHO, Dr. Tedros, has been repeating over and over throughout the pandemic and even before that is that we are not safe until everyone is safe. We have porous borders. We live in a global village where we're dependent on each other for everyday activities, for business, for everything. So to assume that you can actually look after yourself, whether you're a city, a country, or even a continent, without considering the implications of what's happening elsewhere, is a delusion. So whether good or bad, if there is your neighbor is not able to invest in its health system, then no matter how much investment you make, you remain vulnerable. So it brings me back to what I said about the importance of working collectively and complementing each other. We talk about building capacity. In one of the sessions here at this conference yesterday, Dr. Chikwueze, who used to be the Director General of Nigeria CDC and is now Assistant Director at WHO, raised the importance of not just building capacity, but collaborating and sharing that capacity within the continent so that we can pull each other up collectively.
So how do we finance it? Because this is the issue, right? You talk about donors. We know they've played a big role in our continent. Most people probably go to a public hospital that is funded by a government, maybe some help from a donor. But funding is the big issue. I'll come to management in a moment, but we do need more funding.
Yes. We need more funding. We need more domestic funding in particular. We also need the donors, international partners who are investing in our continent to continue to do so. And please note that I use the term investment. Health isn't a luxury, it's a human right. And health is a prerequisite and a necessity for economic growth. So if we see investment in health as necessary for economic growth, we stop seeing it as a nice to have. If we see it as a human right, then elected citizens in each country will hold their governments to account to invest in the health system. So we need, as citizens of Africa and of the 55 AU member states, we need to start to advocate and to challenge our political representatives to stop thinking of health as a nice to have, but as a core requirement. Small changes in the level of investment will have significant impacts on what we do. We also need to be a little bit more efficient as to how we use the resources we do have. There are some duplications due to a lot of parallel and vertical programs that we can actually reduce the cost by looking at across system more efficiently and looking at sustainable long-term investments. And more importantly, we need to move upstream. Treating disease is always going to be more expensive than preventing it. And that's the whole community, whole society approach. We need to have civil society, public sector, private sector, philanthropists, international donors, governments, all pooling together to step upstream and start to focus on prevention much more consistently. That will make our money go a little bit further. But I must state again, no matter how small our economies are, we have got to look at what we're investing in health compared to what we're investing in other areas of our political priorities and rethink the proportions.
The other thing is, and you touched on it already, efficiency. And I mean, this gets to management. Sometimes, as you say, a small thing can make a big difference. I'll never forget during an Ebola outbreak in the DRC, someone basically just started using plastic packets to wash hands at taps. That made a huge difference because you washed your hands better. Things like that. We have a huge conversation in our country about trying to manage the very rich private healthcare system and then the much poorer, less well-resourced public system. We need to get those management problems right.
Yes. Yes. Well, part of the solution and the efficiencies that we need to consider to make our funding go further is to actually look at technological innovations, both in terms of very simple innovations, such as you've just described, to much more recent use of digital technology to increase efficiency and reduce the cost of some of our health interventions. So we can do more with what we have if we think outside the box. We don't sort of just say, we've always done it this way, therefore we continue to do it that way. Take, for instance, the healthcare workforce. We have to, and we have already started to broaden the healthcare workforce. So it's not just at the more expensive spectrum of doctors and nurses, the highly qualified and trained nurses, to start looking at skill shifting. What can be done with a slightly lower level of training and expertise in order to complement the resource that we have and to spread the capacity a little bit further. So we need to think outside the box, and we need to start thinking, what do we have, what's worked in other sectors that we can bring into the health system to improve the efficiency of what we have.
Doctor, thank you very much indeed. Dr. Ebere Okereke is a technical advisor at the Tony Blair Institute for Global Change.